Welcome. Cervical degeneration, pinched nerve, herniated disc, bulging disc, common throughout the world. You can't get away from it. Why? Because of our positions that we put our body through day after day. Looking down, forward head posture, unequal balance on the spine causing stress to the ligaments, muscles, and tissues, affecting nerves, causing imbalance on the discs, allowing the disc to degenerate, causing bulging and herniations. Now, as a result of this, we're getting irritation on nerves, causing pain and symptomatology. The nerves that come out of the neck makes its way down into the shoulder, into the arm and hand, down to the fingers, as well as side the shoulder blade and into the chest region. So you can have complaints of neck problems, or actually no complaints, and have pain at other areas or other sites within the body. The body will refer pain in the muscles will compensate, they'll spasm, they'll shorten, and cause lots of motion restriction. You'll notice that the neck may not turn as well as it used to. You may notice when you're driving you have blind spots, you can't even look and turn around like the way you used to, and you're actually turning your upper body instead of your neck. But the important thing I want to bring out, very simple, those people who have alterations of the normal cervical curve, where you have a kyphosis of the curve where it goes reverse, or you have a military or a straightening neck, you'll notice a tremendous amount of people, high percentage of people will have a military straightening of the neck because all the forward anterior head translation, anterior head carriage, you've been carrying your head for all these weeks, months, and years, the body will then again compensate and compromise from that position you put it in most. As a result of that, you start experiencing symptoms, and people will talk to you about a cervical pillow. What kind of pillow do I sleep on? Well, ideally, the best kind of pillow to sleep on is where your spine is in line when you're on your side, okay? But if you're on your back like this, obviously, you don't want your pillow propped up. Let's go this way. We don't want your pillow propped up too high where your head's coming up, and we don't want it propped down too low where your head's coming down. It should still be in a neutral position. Although, if you look at this picture right here, you can see the little humping in the cervical curve. There are different kinds of pillows, different kinds of densities. Some have memory foam, but the key thing here is that you want to make sure you support that neck to support that cervical curve. If you look here, that's the cervical curve going in. If you have a straightening of the neck, ideally by keeping something behind that neck area, we ideally want to allow those muscles to change over time. So when using a high cervical pillow, or using a pillow that's too firm, and you notice that you put your head and neck over that cervical pillow, after an hour or two or a few hours, your neck is hurting worse. Why? Because we're pushing those muscles too quick. These muscles have taken a long time to get like this. So we gradually, over time, want to retrain those muscles little by little over time so those muscles can get used to it. Now, I'm a big believer that people will say, well, if I have more of a curve or something more I can put on my neck to get my curve back, I want it. Now, ideally it's not true, because if something is too high, it's too abrupt for the neck, the head being 12 pounds, compressing backwards with the neck following it, and we're putting too much stress on those ligaments and those muscles, we can then cause more irritation on those nerves, causing pain. I always recommend people who get cervical pillows not to get a real high one, but get one that is just simple. Something that's not overly round, just something that will just support the neck. And again, remember that because of this has taken so long to get like this, we gradually want to rehabilitate that neck over time so we can work the dynamic of the normal cervical curve so we can actually help the neck heal and stabilize better. You can leave your questions below. I ask you to share this video, and please subscribe if you haven't, so you can continue to receive more health awareness naturally. Obviously, that's why we're here, to help you naturally without the use of significant drugs or any invasive procedures. Share this with your family. I think that it would help them. And most important, I ask you to make it a great day. I'm Dr. Alan Mandel.